This young woman will be asleep in just a couple minutes. But while she wants the surgery, this is the part she has been dreading. The process of going to sleep can be super nervous for some people, and she is not looking forward to the needle or the sensation of being sedated. She's wide awake now, but once the IV has been started, she will be given medication to calm her and help her relax for the next step. It's normal for her arms to be out to the side and restrained. The position gives her doctor easy access to start her IV line and ensures she won't try to grab at the site of the injection. Notice how she is easily able to move and respond prior to the first medication being administered. Now it's time for her doctor to find a vein and start the IV. Many young women worry about the loss of control that comes with falling asleep and not being able to wake up until the surgery is over. Her nervousness only increases as she watches the work, knowing that she's about to sleep. Bodies often react to the somewhat helpless situation, but they've kept her covered up so that she doesn't need to worry about if her body responds, because no one will see that private moment. The video cuts away for a moment, and when we return, notice how she has changed. The sedative given a minute ago is now keeping her still, and we can see she's feeling sleepy already. The doctor connects the propofol to her IV and very slowly injects. She knows the white liquid will make her sleep, but her instinct is to fight its effects and stay awake as long as possible. Nervous patients like her often stay awake a little longer as they fight the effects of the drug. Injecting slowly, as we see, gives her a chance to slowly accept the sleep instead of feeling forced instantly. The medication causes a burning sensation as it travels through her arm, and while she's already sedated, she still reacts to the pain, but can only look and wait for it to stop. She isn't sure what to do now. Her perception is already changing, and she is having trouble focusing. Even her instinct to squeeze tight inside is muted by the medication, and her muscles barely contract. All she can do is try to keep thinking. Just when she looks to be drifting away, she struggles to open her eyes and keep awake. Her doctor injects the rest of the medication into her arm, knowing it will stop the fight and let her finally slip into a deep sleep. She's licking her lips because they are tingling, and she experiences a metallic taste in her mouth. As the first injection is finished, she's still trying to swallow and focus, but her eyes are closed and won't open again. Unsure as she's going to be able to keep struggling, her doctor connects the second batch of medication and injects some. But finally, every muscle relaxes and she gently stops breathing. She's waiting to be intubated. She will have a few breaths of oxygen pushed into her lungs manually, and then intubation will be performed. She will have full memory of getting onto the table and the IV being started. The nervous struggle will have helped her keep remembering longer than some, but those memories will be fuzzy. She is unlikely to remember her last attempts at staying awake, and the final time she closed her eyes will be a blur by the time she wakes up. The good news is, her surgery can be safely performed, and for the first time in the last several minutes, she isn't nervous anymore. In what feels like just moments to her, she will be awake and start her recovery. If she was awake, she would struggle with the breathing assistance, but now that she's asleep, she looks peaceful as the ventilator keeps her breathing in a slow, steady fashion. It is giving her vaporized medication to keep her asleep as long as needed, even as the injected medication wears off.